Good day, everyone. My name is Angela Okpairi Obenimosi, and I am a student of the Certificate of Higher Education in Health and Social Care at the University of Suffolk. Today, I will be presenting my assignment on analyzing the strengths and limitations of a communication style, focusing on assertive communications. In my introduction, assertive communication is a communication style that allows individuals to express their thoughts, feelings, and professional opinions clearly and respectfully, while also respecting the rights of others. In this presentation, I will discuss the strengths and limitations of assertive communication and explain how it can be used effectively in health and social care practice. I would like to talk about the strengths of assertive communication. One important strength of assertive communication is clarity. It helps professionals, gives clear and understandable message, which reduces confusion in health and social care settings. Assertive communication also encourages openness and honest discussion between professionals and service users. It also helps to build trust and improve therapeutic relationship. Another strength is that it supports patient autonomy. It allows service users to express their concern, needs, and preference and take part in decision making about their care. Overall, assertive communications improve understanding, teamwork, and person-centered care. I would also like to talk about the flaws of assertive communication in health and social care. One weakness of assertive communication is that it can sometimes be misunderstood. In some situations, people may think it sounds rude or too direct, especially when there are cultural differences. Another challenge is that emotions emotion situations such as emergencies in stressful environments can make it difficult for people to communicate assertively. They may react more aggressively or become passive instead. Power imbalance can also affect communication. For example, some patient or junior staff may feel uncomfortable speaking openly, even when the intention is respectful and supportful. Therefore, assertive communication is very useful. It must be used carefully and appropriately in different situations. I would like to talk about the applications in health and social care. Assertive communication is very important in health and social care practice, especially in clinical settings. It helps professionals clearly explain treatment and diagnose to patients and also supports setting professional boundaries with patients and their family. It is also essential in safeguarding situations. For example, professionals must communicate clearly when reporting abuse, neglect, or unsafe practice, including whistleblowing when necessary. In addition, assertive communication is very important during multidisciplinary team meetings. It helps professionals speak confidently to protect patients' best interests and raise concern about unsafe discharge decision. Overall, Assertive communication supports safe, clear, and effective teamwork in health and social care setting. I would also like to talk about the effectiveness. Assertive communication is very effective in several situations within health and social care. For example, during informed consent, it helps professionals clearly explain the risks and benefits of treatment so patients can make informed decisions about their care. It is also useful in conflict resolution. Assertive communication helps manage disagreements between staff or with families in a respectful and professional way. In safeguarding situations, assertive communication allows professionals to confidently report risk or concern without sounding aggressively. Assertive communication also supports safe practice, teamwork, and patient protection in health care settings. I would also like to talk about the challenges. Assertive communication can sometimes become challenging in certain situations within health and social care. For example, cultural sensitivity can affect how communication is received because direct communication is not encouraged in some cultures. It can also be difficult in extreme emotional situations. For example, grieving family may see assertive communication as cold or insensitive. In hierarchical healthcare system, junior staff may feel uncomfortable raising concern with senior professionals. In addition, patients with cognitive impairment may find face-to-face communication more difficult to understand. Therefore, professionals need to adapt their communication styles depending on the situation to make it more effective and supportive. Now I will talk about the improvement. There are several ways to improve assertive communication in health and social care settings. One important method is communication skills training, such as role play exercise, simulation training, and using tools like the SBAR communication module. Cultural competence education is also important because it helps professionals understand different communication styles and respect the needs of people from diverse backgrounds. In addition, developing emotional intelligence through active listening, empathy training, and self-awareness can help professionals communicate more confidently and respectfully. Overall, these strategies can support more effective assertive communication and improve the quality of care provided to patients. In conclusion, assertive communication is one of the most effective styles in health and social care because it promotes clarity, patient safety, teamwork, and professional accountability. However, its effectiveness can be influenced by factors such as cultural sensitivity, emotional situation, and organizational support. When healthcare professionals develop strong assertive communication skills, it helps improve the quality of care and leads to better outcome for patients. Assertive communication supports respectful, safe, and professional practice in health and social care setting. Here are the references. These are the references I use to support my presentation on assertive communication in health and social care. They include authors such as Abati and Amos, whose work explains the importance of assertive communication in promoting patient safety, team, and professional practice. I also use recent research study that highlights the role of assertiveness in improving communication within healthcare settings. All sources are presented using the Harvard references style. Thank you for listening.